Hi, my name is Dr. Rudra Mohan and through the Oral Health Channel. Today we're going to be talking about the surgical excision of leukoplakia and non-scrapable lesions or hyperkeratotic lesions with the help of a soft tissue diode laser. Let's start. So I feel this episode is very important because I live in India and there are a lot of people who consume a lot of tobacco and tobacco related products, thereby which they develop PMDs, which are potentially malignant disorders. Now a lot of them developed white hyperkeratotic lesions or leukoplakia like lesions where there are no symptoms per se, but it causes them a lot of discomfort, mental discomfort, because of the fact that they are visually unappealing and they keep on reminding them that they are undergoing a cancerous process. That's one thing. Secondly, there are a lot of conventional ways of dealing with these lesions. You can go for blade surgery, scalpel surgery, electrosurgery, cryosurgery, but they have their own limitations such as post-operative discomfort, swelling, some cases fibrosis, even recurrence of the lesions, malignant transformations, and very rare occurrences. But nowadays we have a newer technology, which is the laser technology, especially the diode laser technologies and carbon dioxide laser technologies. I'm going to be talking about the soft tissue diode laser that we have at our practice, which is going to be used for patients, and I'm going to be releasing some episodes sometime soon when I start recording the excision part of the leukoplakia and white hyperkeratotic lesions with the follow-up, so that you can have a look and you can probably make that decision. There are some contraindications if you are having some sort of a debilitating systemic disease such as uncontrolled diabetes or any other disorder which could be related to blood parameters. You might not be a great candidate, but if you want to get these lesions excised because you don't like their presence in the mouth, or they cause problems in terms of mastication, you feel that there is a rough corrugated surface, you can get them excised under local anesthesia. It's not an in-hospital procedure. It is an outpatient procedure which can be done on the dental chair under local anesthesia. The laser itself is very painless and it is very hemostatic. That means it creates a field which is bloodless. So after we localize the margins of the lesion, we make sure that we dissect and surgically excise the margins and that lesion with the help of lasers slowly in feather strokes, and we let the healing happen with secondary intention. Now the beauty about these procedures is that they are very painless. First of all, we will give you anesthesia if required. Secondly, the laser itself has an anesthetic effect because of the heat. It has a thermoablative effect. On top of that, it promotes new blood vessel formation, that is angiogenesis, and that's where you will get very less scar formation because of the fact that there won't be wound contraction to that extent compared to the conventional methods. The only catch is that you should have quit the habit for a long time, and you can give us in writing. You should be systemically healthy, that is medically healthy, so that you're not a contraindication with the procedure, and you need to follow whatever instructions we give, right from the antibiotics, anti-inflammatory medications, to sometimes in cases of buccal mucosa where we might suspect some sort of cicatrization of the wound, that means wound contracture, we might want to put you on physiotherapy exercises so that you don't get this kind of a closure of the mouth or some sort of fibrosis. And a regular follow-up is absolutely necessary, so that we can make sure that you are the lesion is being followed up, there is a regression, there is no recurrence, and unfortunately there should not be any malignant transformation. Now I've gone through the literature and the systematic review and the meta-analysis. The malignant transformation rate of surgical excision with the laser is much lesser than actual conventional methods. More importantly, it is much painless compared to the conventional methods. The healing time is faster, your pain scores are lower when it comes to laser, and the recurrence rate is also reported to be lesser. Now if you are planning to get this done, you can contact us regarding this procedure and make sure that all the conditions that we've told in the the episode that we've talked about the diabetes and all those things, and the habit, especially the habit history, that you've completely quit the habit, these conditions are fulfilled, and then we can have a look at you. So this was today's episode. Please like, share, subscribe, and do press the bell icon button for important updates. If you want to get in touch with me, here are my social media handles. Kindly refrain from calling me directly, as I might be busy with patients. Just drop me a message with your name, your location, not just the city, not just the district, but also the state of India or anywhere else in the world, and the common oral health problem that's causing you discomfort, and then we can have a chat. And please be patient. I might reply in a couple of days because I'm busy with patients or otherwise. And if you have any queries, doubts, apprehensions, or insights, please feel free to put them in the YouTube comment section. So that's it for today. Thank you.